go ahead with what all things have been done and not done. So let's go back. So now, what should incident commander do? Yes, checklists are already being used in the medicine. A lot of checklists we have, surgical safety checklist and all other checklists. So what is the job of incident commander is like he or she has to ensure that overall plan activation has been done or not. Now, this is the quick activation plan and this is a checklist which we will share with you, and we may have discussed this in our earlier lectures, like what is the security set ICT zones. So these are all the checklists which is being used for quick activation. Now, step-by-step confirmation of the activation is needed, and there is a checklist for that, which we'll share with you from the WHO Academy, that these are the checklists which is being used. So these are the checklists which will be used for once the activation is done, how you can go ahead with confirming that yes, heightened readiness is there or not, security crowd control has been done, triage, all the three, triage kit is employed, triage in charge is at the triage point, everyone is getting ID. So these are the checklists which is to be filled by the incident commander once activation is done. So now let's go ahead with analyzing the following situations that require the incident commander interventions, and we'll discuss the proper solution.
Sure, how to help you with that?
The point is like we'll go ahead with discussing that. So, Rupa ma'am.
Yes,
Hello.
sir. Yeah, yes, sir.
Ma'am,
Sir, am I audible?
yeah, I think there is some problem with my laptop. So, is anyone who can answer this question?
Yeah. So can I request them to write in the chat box? That would be okay, sir. And sir, when you are sharing your PPT, at the bottom of the left, you will be seeing share with the audio. Sometimes that's skipped automatically, na?
Now I
Because we
can.
keep on sharing.
Yeah. I can hear you.
Yeah.
So, yes. So now let's start with discussing. So everyone please be attentive. So now we are going to discuss some case scenarios about if you are the incident commander, how are you going to react? So, because of the upcoming election, the TV reporter says that in a couple of hours, a mass gathering is gonna happen. Police forces are on standby. What do you do? So I request everyone to be attentive, and anyone can answer this question. Anyone can answer this question. So please be attentive. We'll be discussing maybe 10 scenarios that how incident commander, if you are the incident commander, how you are gonna respond to it.
So you want them in an audio form? I
Um,
should ask them to unmute themselves and answer the question, sir.
it is better if they can switch on the audio.
Hmm. Yeah. So can we request somebody? There is a no right and wrong answer as we are in the learning phase. So please feel free to raise your hand and then we will unmute you, ma'am and sir. Anybody?
ये खोलते ही साथ इसमें फोटो आने लगेंगे हम लोगों की, देखना है तुम्हें और लोगों को, तुम्हारी तरफ कर दें, क्या करना है?
I think otherwise what we can do is like, yes, these are the questions. I can go ahead with discussing, but I wanted that everyone should be able to discuss that. Yes.
Yes. Sudipta ma'am, would you like to unmute yourself and want to speak so that you can discuss with Dr. Ankit, because I can see that you are a very regular, one of the learner. Yeah, Chitra, unmute herself.
Yes.
Yeah.
Hi, ma'am.
So, over to
actually,
you,
first
Chitra.
of all,
And next question
am
we
I
will be taking
audible?
Deepta ma'am. Yes, Chitra, you are audible. Over.
First of all, we have to confirm the news since we are getting from a news person or from a TV reporter, first of all, as an incident commander, we have to confirm the news that whether it is right or not.
Correct, ma'am. Correct. Chitra ma'am, welcome. Good evening. So, you're right, ma'am. So, yes, even if the TV reporter is saying mass gathering is happening and something is gonna happen, you have to confirm the news. It is your hospital policy that how you're gonna confirm. For example, are you gonna confirm with the police personnel? Are you gonna confirm with the disaster management authority? Now, the point is, it is your hospital policy, but yes, you have to confirm it. So great. So let's go to the next question. This is a
I
question
can
number
see
2.
they
Yeah.
are very nicely writing in the chat box.
Okay.
So you may, if you want, you may matlab you may say their name and their answer. That would be, I think, better.
Okay, ma'am. Okay, okay. So, yes, Praveen sir has told about, yes, proper confirmation. So now point is for the question number 2. I think if you are putting in the chat box, please write the number, the question number, because Christy ma'am has written about triage. So what do you mean by triage here, ma'am? You as an
Christy ma'am,
incident commander, what you are gonna do? I think I'll go ahead with discussing that. It's
yeah,
better.
Christy just now unmuted herself, sir. Yeah,
Uh,
Christy ma'am, would you like to speak?
Triage for arranging or managing the patients according to their needs, means
right,
severity of their illness.
right. Ma'am, think yourself as you are the incident commander. You are not the triage officer. Now, you are the head of the institute now. What you are gonna do? My point is, you guys have to think that you are the head of the institute. Christy ma'am?
Yes, sir.
So now point is, you are right. You have to activate the MCM. What you are suggesting is like, yes, triage will be done. So now this is the job of the personals who are on the emergency unit on the floor, who are gonna activate you are gonna activate the MCM. So now point is, you have found that some patients are in the waiting room presenting with minor wounds. Report that security forces are currently charging. So now you are again in a doubt that whether the patients are going to come to you or not. So again, confirmation is very necessary. Second thing is like something called as heightened readiness. You should be prepared that yes, if at all the patients are coming to me, I'll start the triage, I'll activate the SET, that is security, evacuation and triage, and I'll activate the MCM. So you are right. We'll start with triage, but as an leader, as an incident commander, you are going to check whether your heightened readiness is correctly prepared or not, and you have to activate everyone that MCM might be coming.
So we have to coordinate with every department.
Sudeepa ma'am, yes, for now, for this for this scenario, you may not have to start coordinating, but you have to just see the baseline preparedness. Are you ready to activate the MCM? Because here,
After confirming the news, we
right.
have to be ready for that
Yes. And you
situation.
have to, you as an incident commander, once you are activating, you have to use the checklist so that your activation is correctly done. And then you have to coordinate with other departments. For example, OT, ICU, mortuary facilities, and all other facilities. So yes, it is the job of incident commander. Okay, ma'am? So let's go to the third scenario. A loud bomb explosion was heard. Probably it occurred in a nearby market. In a couple of minutes, dozens of wounded may be rushing towards your emergency department. What do you do? Anyone? Anyone can answer these questions?
Sir, again, we have to confirm the area and how much people can be affected
Yes,
in the
yes.
incident.
Yes, ma'am, you're right. So now point is, yes, again, we have to confirm. But sometimes what happens, for example, you are in the emergency department and loud bomb explosion, you can hear. for example. So now the possibility is that the patients are gonna rush into your hospital. So sometimes it is very hazy to when to activate the mass casualty. Here, for example, we are just residing near a big market called a Sarojini market. So if there was a bomb explosion in the Sarojini market, we might have to activate the MCM. The reason being, you are listening to that, no? So I don't think you may need to confirm it up. But yes, how many patients are coming? Who all are coming? So those all incidents, yes, you have to reconfirm. But again, in this case, heightened readiness is very necessary. Whether to activate or not activate, you might take a back step and decide whether I'm gonna activate or not activate. So you're right. Confirming the news and how many patients are gonna come is very necessary. For example, in the night, if bomb explosion is happening and there are no people there in that market, so I don't think you may need to activate the MCM. So it is again a dicey situation, but you as an incident commander have to confirm it again. Yes, great. So next, as a result of bomb explosion, you have activated. For example, you have just activated it, the MCM 10 minutes ago, and local news agencies are calling on your personal phone. They want information on the number and type of casualty. What you are gonna do? You are the director of your institute. Anyone can answer this?
Once we got a call and we have activated the mass casualty management protocol.
Yeah, ma'am.
Once we can update in a regular intervals like 1 hour or 2 hour interval to the public with the help of mass media cell or anything.
Right.
We should not respond them to through our personal phones or anything.
Correct, ma'am. Correct. You're right. Thank you, Chitra ma'am. The point is, no personal phone should be used because you don't know how those information will be used. So, for example, if local news is calling you on personal phone, please tell them, no, I have a media cell handler who will be taking care of it, or please call me on official phone. And any information, yes, to start with, you may not have all the information with you. So please tell them that I will inform you on the official channels. But once I get the information, maybe as you have told that maybe frequently 2 hourly, 3 hourly, 6 hourly, you can inform, but not through your personal phone. Great. Now, your MCM plan is activated. Your emergency unit is crowded with injured people. Family members that were blocked outside of emergency unit demand that hospital provides information about their relatives. They're becoming violent. So what is to be done? Anyone?
Sir, in this case, our security personnel uh, has to be that efficient to handle them and to be
Right.
polite and kind, empathetic to them, first of all.
Right. You're right, ma'am. It is, again, the security personnel should be able to handle the crowd. But there is something what you as an
Yes.
incident commander can do.
Incident commander can explain them at least to be
Right,
peace.
right. So yes, once you are activated and your hands are free, you can go just give a small amount of information that yes, we are managing your patients, everyone is there, we are gonna give you the information. So you have to be empathetic, as you have told us that you have to be empathetic as an incident commander. Also, you have to be empathetic. You have to be very sure about that. Yes, your patients, your family relatives are being taken care of, and we are going to give you information as their clinical works are being done. So I think those are the things that we have to do. Great. Now, sixth number question. Your MCM plan is activated and you have 5 critical patients waiting in the operating room, and currently only one available surgeon is there, and who is using the operating table, and he just started the hernia procedure under regional anesthesia. What you are gonna do? You are the incident commander. This is a difficult question, but there is obviously there is no right or wrong answers to it. What can be done? Anyone? Anyone who can answer this question? The surgeon, only available surgeon, has just put on hernia procedure. What is to be done?
Sir, we
According to
can
the
postpone the case.
Ha, ma'am. Sudeepa, ma'am. Hello. Chitra, ma'am, you are also suggesting something?
based on the rotation plan or disaster on-call duty or anything, we have to call the persons on duty that time immediately.
Mhm.
And resources also, if we can arrange any other OT tables or anything, we can take the patients there.
You have only one surgeon in the hospital.
Immediately we can call from other departments or any like in on-call or anybody is there means we can call them immediately.
Right, right. So now here comes the point
Can I,
of hospital protocol.
can I
So,
add on?
yeah, sir, please.
Yeah, I'm Samuel Ravi from ex-CMC.
Hello, sir. Bataiye, sir.
Yeah, I think it's a very interesting and a very good question because it's a challenge between capacity and capability. You
True.
may have even 8 surgeons, but there's only one table there.
Yes.
So the vulnerability is there. If the hernia patient is not incised, then the patient is moved out and vulnerable critical is taken in.
Right.
But these are all easily said and done. But it's good thought provoking so that we can think about it in worst case scenarios. Who makes the decision at that juncture? I think that becomes very important. And
Yes.
that is why the incident commander actually sits on tender hooks to make the decision.
True, sir. True.
Yeah.
You're
That's
right,
it.
sir. Yeah, you're right. The point is here, the decision is very difficult. Now, why we have kept this question is for one big reason. Always keep your hospital MCM plan ready prior to the MCM which is coming. Now, this is where there will be a huge fight that is gonna happen. Now, incident commander is the director, for example. Now, the surgeons will be like, no, I don't want to close. Some will tell, no, I want to close it up. So again, when to abbreviate the surgery, when to stop the surgery. For example, if skin incision has been put, I'm just giving you a suggestion. If the skin incision is there, but the patient is under local anesthesia, the hospital may decide that yes, this patient can be immediate closure can be done. He or she can be shifted to a pre-anesthesia area. So something like that. So these are needed that to be discussed with the director or medical superintendent, department of surgery, all other allied facilities which are involved in the MCM, so that this plan is clear that when to stop a surgery, when to abbreviate a surgery, when you can not stop a surgery. So these are all points which has to be discussed prior. So what we are doing today is like, you have to have a hospital MCM plan, and these all cases which are gonna faced maybe during the flow, during an MCM, it has to be discussed. Some things has to be discussed prior, and it has to be in the written document, so that at that point of time, the incident commander can take a serious action on that. So it is necessary that we have to have a prior MCM plan of your hospital. So I believe we all as a team believe that you guys go back and start working on your MCM plan of your hospital. And these are the things where many senior administrative stakeholders are needed to decide when to stop, when to start, when you cannot stop, and all these questions has to be answered. Great, sir. Thank you. And I think Shailaja ma'am has also written the same thing as per the severity of the wound. But again, it has to be pre-decided in the MCM plan. And one more response was that case can be postponed if anesthesia is not given. Again, this all has to be written. What I'm telling here is nothing called as right or wrong. It is the hospital policy, but it has to be written in the hospital policy. 7th, your MCM plan is activated, but you just ran out of beds in your emergency department. You got a call from the mayor of the city and he wants to come now and get a briefing and a guided tour of the facility together with the TV reporters. This is the real scenario. So what are you gonna do? Anyone? This is a big problem for our resources. Yes, MLA, mayor, anyone can come and tell that I want to have a guided tour with you in the emergency department. How are you gonna handle? Anyone can speak up anything. Your what is your thoughts? What can be done? You can add it in the chat also. Any of our participants who want to answer this? This is again one of the difficult thing that incident commander has to handle. Media and the local politicians. Okay, so let's yeah, can we tell the mayor to wait till the situation is stabilized? Smita ma'am, you're right. Where are you gonna tell the mayor to stay? Sudipa ma'am, we are discussing about whether the beds are filled. Yes, but how to handle the mayor? That is the bigger question here. You just ran out of beds in your hospital. Yes, you have to coordinate with other people. So now how to handle the mayor here? That's why we have discussed, maybe Dr. Charu have discussed about the zones. So that should be one specific area which is called as media zone, where the administrator can talk with the media and talk with the mayor, local politician. So no one should enter the emergency unit. Please remember, no one other than the patients of MCM should enter the emergency unit. Apart from hospital staffs, obviously. So mayor of the city, you have to guide him or her to a place where you can really discuss with him, ki, sir or ma'am, you cannot have politely, obviously politely, that we can discuss it. Yes, you have, as you have suggested in the chat box, we can discuss that later. And you have to give some idea because you have to satisfy them also. And you have to take care of the point that the disruption of the clinical activity is not done. So again, it is a very difficult, challenging scenario for the incident commander to talk with the mayor. But the point is here, one more thing you can ask the mayor is like, sir, I have ran out of my beds. Please activate other hospitals who can take the, who can really take my patients, take the MCM patients there. So yes, we have seen in the chat box, Praveen sir also Praveen sir has also suggested the same thing, that we can suggest the mayor and media that you have to go there in a proper media allocated area, and there we can discuss. So I think everyone is clear somewhat about what incident commander has to do. It's a difficult job. That's why it is the job of the senior administrator to take up this post. Now, 8th, your resource lead has informed that your emergency unit just ran out of the bandages and sterile gauze. Along with that, your oxygen bottles are also running low. What to do? You as an incident commander, how to go about it? Anyone can put it in the chat box also. Anyone can speak also. Yes, contact nearby hospital according to Smita ma'am. Yes, great. The point is your job is to have external communications also. Contact the nearby hospital to share their resources. It is always better to get their resources also and take some load. MCM patients should be shifted, diverted to other hospitals also. With the help of EMT, we can refer to the nearest facility. Brinda ma'am has told, that is correct. That is also, that can be done. And we have to inform the administrators and coordinate with other hospitals. So all the chat boxes, all the chat replies suggest that yes, we have to coordinate with other hospitals with the external communication system, that we are running out of the resources. Please help us. And something else that can be done, we'll try to arrange all the things as a backup from the nearest hospital during the disaster activity. And you're right, we have to get help from external support, can coordinate with external resources, and meanwhile we can redirect the patients to nearby centers. So obviously everyone has written the best possible solution as an incident commander is like, we have to divert the resources. We have to get the resources from other parts. Yeah, hello. Hello. Okay, so as per the chat box, yes, we should arrange all the resources, and specifically we have to inform whatever, if your facility has some of the resources, for example pharmacy, for example your store offices, you have to open that up. And internally, yes, you have to open all other resources, you have to get all the resources. Please remember that Your OPD might have, the orthopedics OPD might have a plaster OT where all these things are available. So you can get from there. Oxygen bottles, you can get it from wards which are not being utilized at present for managing the MCM. So yes, internal resources can be mobilized. And second thing is, yes, as an incident commander, you have to coordinate with other hospital because your resource lead can mobilize the internal resources. But as an incident commander, you have to mobilize external resources from other. Shailaja ma'am, you want to say something? Okay, let's go to question number 9. Doctors and nurses are prioritizing critical patients and small number of dead bodies are left on the stretcher inside the emergency department. What is your responsibility? You are an incident commander. You are taking rounds of your emergency department, or you saw that there are some number of small number of dead bodies, maybe 3-4 dead bodies are left on the stretchers inside the emergency department. What is your role? This is a very, very important question. You are working on as an incident commander. What is to be done? Yes, shift the dead bodies to the mortuary. Smita ma'am, tell me one thing. You as an incident commander, can you shift the patients to the mortuary?
Can give instructions. Maybe.
Yes, you're right. Now your job as an incident commander is giving instructions. So Smita ma'am, can you tell me whom to give instruction? Where is the problem here? The stretchers are being utilized because dead bodies are on the stretchers. So it is where are we missing the MCM plan here? It is whose job?
Not sure.
Yeah. So I'll just discuss this. So now again, just be clear. Now point is, patients are entering into the step 1 triage. Walking, non-walking. Non-walking goes to red zone, walking goes to green zone. Now, dead bodies are usually, obviously, dead bodies are non-walking. So they will enter the red zone, which will be your emergency unit. Now, dead bodies are utilizing the stretchers. Now it is the job of the clinical lead who should manage these patients. So now clinical lead should be able to tell the stretcher boys and should be able to handle the dead bodies and send them to the mortuary. So now there was some protocol deviation here that clinical lead was not able to shift these patients to the mortuary. So now you have to tell the clinical lead that yes, the patients has to be shifted to the mortuary.
बहुत भारी नहीं है वो थके जा रहे हो
Yes, Praveen sir has written that shift the dead bodies to the black zone and then coordinate with the housekeeping head to shift the bodies. Incident commander has to inform the clinical lead to do all these things. My point was that it is not the job of the incident commander, it is the job of the clinical lead who is manning or leading the red zone. So yes, it is a job of the clinical lead to tell them, yes, shift the patient to the mortuary. You can call mortuary people also to take the patients in and leave the stretcher out, because yes, once the stretcher is vacated, stretcher has to go to triage 1. So what I was trying to discuss here is the job of incident commander is to inform the clinical lead to do all these things. So am I clear, Smita ma'am?
Yes, sir.
Yeah, so great. Okay. Let's go to the next question. Again, this is one of the important question is your MCM plan is activated. As you walk through your emergency unit, you notice that a few injured patients from mass casualty incident are currently waiting for X-ray examinations and lab results. And the X-ray room is overloaded. It may take more than 1 hour to get those limb X-rays done. What are you gonna do? What are you gonna do? Anyone? Shalini ma'am, if you want to answer this question. Just think that you are the incident commander. What you are gonna do? Anyone? I'll be happy if anyone answers this. Yes, we can get portable X-ray machines. Aarti ma'am is suggesting that we can get portable X-ray machines from ICU. Okay. Anyone else? Prioritize and do the decisions. Jasmine ma'am. Great. Any other answers?
Hello.
Huh, sir. Huh,
Yeah,
Samuel, please.
correct. Can I add just one thing? I think I do agree with all the points that had been said so far.
Sir.
But there's one interesting concept which is not in India but elsewhere.
Sir.
Done. It's a little controversial, but what they do in MCM scenario is they close down the X-ray department. Reason being, particular to have CT to identify bleeds to theater, but
Sir.
they say there are many incidents of reported deaths waiting at the X-ray department.
Correct, sir.
Patient who are yellow turn into red because they wait. So what they is only to identify the fractures and those kind of a thing, which clinically you can identify in MCM and handle. Subsequently, when settled down, you open up and do it to save the lives of patients who may deteriorate in the waiting area of the X-ray. I mean, I'm not saying this is the absolute one, but it can be a different school of thought. But there are certain countries which adopt this to minimize complication developed during waiting hour in the X-ray department. Just a thought.
I think Samuel, sir, that is the best answer that we have got. Frankly, this is what is the MCM protocol is. If in our previous lectures we have not been able to inculcate that X-rays should not be done. As Samuel sir has correctly pointed out, frankly, sir, this is not a school of thought which is different. This has to be done. You are right. Now, point is, whenever a patient who is requiring X-ray are getting X-ray during MCM, it is wrong because you have to take care of the red patients and you cannot send them for X-rays. So, as I have seen in the chat boxes, please be sure and please ensure that X-rays should be closed. Please be ensure that X-rays should be closed. If the patient is having fracture, the patient is a yellow category patient should be sent to ward, and from the ward later on you can get an X-ray because X-ray is not life-saving. Please remember that. And I think that Samuel sir has clearly discussed that this X-rays or any radiological investigations should not be done in an MCM. The reason being it might delay the care for red patients and it might hamper the care. So what we are doing in our emergency department at AIIMS Delhi is like, yes, yellow care upstairs. The point is that, so any patient who is being triaged as yellow may require some X-ray, require some CT scan, anything, the patient has to be shifted directly to the ward. Clinical judgment is the most important thing. No investigations from the emergency department. And yes, T. Ravi sir is a well-read emergency nurse with 3 country registrations. So yes, thank you, sir. This is the Ravi sir. Thank you for your contribution to the concept that this is what is to be done.
Thank you.
This is one question which I wanted you guys have to inculcate that in MCM, no X-rays. Now, what is the role of incident commander then? So Samuel sir, can you just add on what you as an incident commander you would have done here? Where is the problem happened here?
Sorry, I didn't get it.
So sir, you are acting as an incident commander, and while taking the round, you found out that your some patients are waiting outside the X-ray room. So
Yes.
what is your role now?
There are 2 things in my role. Number one, as you rightly keep on pointing out from the beginning, that all these requires a pre-established protocol.
Yes.
Rather than deciding by the incident come at the moment, which will be very subjective.
Sir.
So I think I'll take the guidance of my existing protocol, and based on that, situationally, I'll decide what to do. So that's point 1.
Yes.
Because if I'm led to decide, then it becomes subjective and my emotion can play a role. Number 2, I would have somebody else who could triage those victims, and those who are critically ill moved back to EU rather than waiting in the X-ray zone.
Yes, sir. Yes. So Ravi sir, great. So what you have told is the right thing, because if your MCM plan is not in place, you might have to do like that. That X-rays, all the patients has to be shifted to their own zones. If the patients are sick patients, has to be sent to the red zone. green patients has to be sent to the green zone, and from there clinical care has to start. If you have a written protocol, which we believe that every hospital should start working on that. If we have an MCM protocol where you have clearly mentioned that X-rays should not be done. Now point is, it is the job again of the clinical lead where protocol deviation has happened here. So now here, if you have a written MCM plan where you have clearly written, frankly, in all MCM plan, it has to be clearly noted out that radiological investigations should not be done from the emergency unit. So if protocol deviation is found, the role of clinical lead is here. The clinical lead has to be asked why this protocol deviation has happened, and again shift the patient back to their own places. But if your protocol is not well in place, as Ravi sir has correctly pointed out, you might have to again take the middle pathway, send those patients to their own specific zones, and again go back and tell the clinical leads or green zone leads that please don't send these patients to the X-ray. Do it clinically, and if the patient require an X-ray, send them to the wards. So I think I'm clear here that what Ravi sir has added and why we need a specific protocol for your hospital MCM plan, because these are the questions which are gonna come if you have not really answered it previously in your protocol. So I think that's a great discussion with Ravi sir and all other participants who have written in the group. Please, I'm reiterating, no X-rays from the emergency unit. All yellow care should be given upstairs. Yellow care upstairs. So that is what I want you guys to remember. Yellow care upstairs. Any patient who is yellow requiring any investigation should be sent to the ward. Later on, they can get. So I think that was a great discussion here. So again, summarizing the total discussion about incident commander, what are the main responsibilities? Yes, he or she has to activate the MCM, deactivate the MCM, internal communications, external communications, handling the media, handling the family, and debriefing. What are the main challenges of the role? Obviously, you must have seen in the last 10 scenarios, what are the main challenges? There are a lot of challenges in the role. What kind of skills are expected from someone who takes this role? Administrative skills, empathetic skills, communication skills, and all other skills which are necessary for an administrator to handle all these problems. So I think I was able to deliver online about what incident commander has to do. And checking the agenda again. Yes, we have discussed specifically about the what is the incident commander, what is the ICT roles, what are the roles and responsibility like overall plan implementation, internal, external communications, activations, debriefing, using the checklist. And that's all for today. And I think that's all for today. Thank you everyone for your patient listening.
Yeah.
Any
So,
questions?
sir, thank you very
happy.
much
Yeah.
for the amazing session, a very interactive. And thanks to the all participants, especially Ravi sir. Thanks for adding wisdom. And Chitra ma'am, Sudipta ma'am, Ravi sir, Praveen sir, so many others, sir and ma'am. Thank you very much. So I hope you won't mind if I say that I have posted a link, and please do assess your knowledge with this link, because this is not about just to have a scoring system, but definitely you have been, undergoing these sessions from last 10 days. And I know you will be definitely liking when you will be getting your scores over. So please feel free to click on the link and just check your assessment.
Hello.
Huh, sir.
Yes,
Huh,
sir.
Ravi,
Hi, sir.
please
Yeah,
go ahead.
Ravi sir.
I just really wanted to record my sincere appreciation to Dr. Ankit, because I'm sure he would have done a lot of incident command. But I think taking the session on incident command for such a short period is much more challenging than actually doing the incident command.
Correct,
because
sir.
incident command is such a challenging. But I think I would really appreciate those 10 points for discussion, because I think the need of the hour is such critical thinking that is needed among the team, rather than really going on with some predetermined PowerPoints. I think really appreciate WHOCC for taking the effort to focus on incident command. In fact, in a few weeks' time, we are going to conduct a workshop only on incident command system at Chennai, because I know preparing for that itself, we know he is attempted to do his best to cover the whole lot within the short span. And I hope and pray that it will be in YouTube, so that it can be shared all across the country so that people can benefit out of those 10 points of discussion. And thank you very much, Dr. Ankit, and for the whole team. God bless you.
Thank you, sir. Thank you, Ravi, sir. Thank you so much for your kind words. Thank you.
Thank you, sir. Highly appreciated. And just to add, yes, these all sessions are almost on YouTube. We sincerely apologize because our team is keep traveling to the difficult area. So sometimes it's difficult to start the session on YouTube streaming on time. But yes, today, after 5 minutes, we were YouTube stream. So our all sessions are available over there. I'm just sharing that link. And I request you once again, please do click on that link and do the assessment. Thank you very much.
I think if you have any questions, we can discuss that. Anyone, any doubt, any questions? Incident commander is a difficult job. It's a difficult job, but any questions, we'll be happy to discuss that. So if not, I think Rupa ma'am, we can close the session then. Everyone should be able to click on the Google form. No?
Yeah, thank you very much, Dr. Ankit. I request you, you may leave. And if somebody wanted to still do this assessment, please do take this assessment. That would be another, added on for your some more learning. With that, thank you very much, sir. You may log out, and I will be holding it for next 15 minutes so that if somebody wanted to take that question, so they may have this link. Over. Thank you very much, sir.
Thank you, everyone. Bye-bye.
Bye, sir.
Bye.
I sincerely request everyone, please just click on the link and give answer. Whatever answer you want, please do that. But do try to check your assessment. Or you can do it at your free time. You can, save the link and answer whenever you want. There's no hard and fast that you have to do it right now. With that, thank you very much for a successful series on mass casualty management for nurses. And we sincerely thank each and everyone for having us such a wonderful gathering every time whenever we are having these sessions. Thanks, Atan. God bless you. Be safe. I hope and I wish nobody needs this type of mass casualty management. But in case if we would be facing such situation, we are quite equipped to do that. Thank you.